It's a personal story. A story where I lost my best friend at the age of 32. And this is a guy who was strapping good health, does health checks on a regular basis, but he was just gone with 10 minutes notice. I had to find out what was going wrong with it, with him. And for that matter, I wanted to know exactly what I could do to solve that problem. And I quit my 30 years life in the US, jobs, everything, to India because he was here, number one. India is the diabetes capital of the world. It's an interesting story. I liked numbers all along. So predictive analytics, which is where I'm focusing on, is no different from any numbers that I have tackled in my engineering studies. And that's why I just want to solve this problem. The idea is, if you really look at the chronic diseases problem in this world, it's at an all-time high. These are non-communicable diseases. Now, if you look at India, what you'll also find out is that India is the diabetes capital of the world. And 1 out of every 8 Indians between the age group of 20 to 29 is either diabetic or pre-diabetic. That's an epidemic. And so I wanted to hit and tackle that epidemic as best as I could. The idea, again, is to take evidence-based science, which is lifestyle, food habits, and all of these other pieces of information from this person, mash it up with clinical data, and then, as I said, using evidence-based science and predictive analytics and cognitive computing, I'm able to then produce a solution which gives them very clear indication of what their risks are and exactly what they need to do in order to reduce those risks in a very, very effective, simple step-by-step solution. If you have clinical data, which is something that you can get when you do health checks, or give us a call, and we organize those things. And once I have that clinical data, I'll ask you some questions which relates to your hereditary, your lifestyle, and your food habits, exercise habits, and all of those things. Once I have all that information together, then I put it into our algorithms, and these algorithms not only computes disease risk, but benchmarks your health and keeps track of it with time to see how you're progressing. So we are able to help you there, and then we give you the step-by-step solution, which is nothing more than taking small steps, mini steps, to be able to get you out of these problems. Now, one thing I wanted to add to this, chronic diseases by their nature is such that if you have some kind of a symptom, it's already too late. Therefore, to prevent chronic diseases, you got to be able to predict it. And that's why we are in the predictive domain so much more than others. Absolutely. There's a lot of people who are working with people who are sick. We want to work with not only the sick people who are always there, we can help them, but we also want to work with people who are healthy right now and don't even know what is going to hit them shortly. Well, we have been lucky that we got some angel funding so far. And right now we are looking for getting this to the next level. We have some traction from the customers. We are now have to reach this goal that we have set for ourselves, which is 1 crore subjects in the next 2 years. So definitely looking for funding as we move forward. Actually, I have to be very honest, the GenX Proud program has really made a huge difference in this whole thing. We're very lucky to be selected 1 out of the 350 people or odd people, companies that applied. And once we got that, now we are taking the next leap of faith where we are saying to ourselves, yes, we can touch many lives, and GenX is making it happen for us. They're connecting us with the right people, infusing us with the right energy, and giving us the resources that we need to make this happen.